Welcome to Dynamino Show as a part of Digital Health Days conference.
Today we have Sjoerd Haasl, who is the Director of Clinical Innovation Fellowships. This is a program that is designed to bring in multidisciplinary professionals in order to create innovative healthcare solutions.
So, welcome Sjoerd. It's such a pleasure to have you here. And to start with, can you explain to us and to the audience what exactly are you doing in the Clinical Innovation Fellowship program?
Well, within the Clinical Innovation Fellowship program, we put together teams of 4 people who work during 8 months full-time in a clinical environment. So these people have different backgrounds. We always have a physician, we always have an engineer, we have design knowledge, know-how, and we have management engineering. And these 4 people, they get placed at a department in a hospital, and they look for needs in healthcare. And they follow this through. They analyze these needs, and from these needs, they try to find new solutions. And in the end, we want them to develop a business plan that hopefully will result into a new company that improves healthcare.
So it's quite innovative, cross-disciplinary approach to creating innovation.
Yes.
So can you tell us about some of the projects that were implemented in real life, resulting from the fellowship?
Well, we have this program has been going on for 5 years. And for example, over the past 2 years, we've had 2 teams coming out with a solution that they've been able to get pre-seed funding and get on the first steps on the road towards reaching the market. One of them has developed a handheld device for detecting a condition called peripheral neuropathy, which is a condition that affects diabetics in the sense that they lose sense of touch in extremities. It takes a long time for solutions like these in medical technology to reach the market. And this is exactly why we work the way we do. We took this way of thinking, or this methodology, which is called the Biodesign methodology. We got inspired by Stanford, which has a program which has been going on for about 10 years right now. And the reason why we use this methodology, which is based on identifying the needs, on making absolutely sure before you start working on solutions, whether this need can be addressed by the team in the surroundings that you're at, within this healthcare system, and once you're sure about that, only then you start thinking of ideas and solutions. Because in medical technology, it takes 5 to 10 years sometimes from an idea to reach a market.
So just to sum it up, what is needed to scale up those solutions that created during fellowship program?
First of all, you need a good team. You need a team that has all the aspects or all the know-how required at the right point in time. So that's why we have the physician to have deep clinical understanding. That's why we have the engineer for the technology. That's why we have the manager for taking care of the business part. We have designers to make sure that the product itself is for usability. But that's just a starting point. Then you need an environment in which they can work. And when it comes to medical technology, and more specifically to digital technology, there are a lot of challenges on the way. One example is within Sweden, you look at the patient registry systems, it is a jungle of subsystems. The sheer volume of these systems is immense. So what we see sometimes is that teams identify needs, but digging deeper into these needs, they say, okay, we would need this feature or this group of features. But they find out that several of these features exist, but people just don't know about them.
Okay.
The complexity is just too great. So I think one of the important things that we can do to help teams like these, to help innovators and entrepreneurs, is to actually create an interface, is to have some kind of structure that receives and channels the people to the right subsystem, to the right infrastructure, to the right instances working with these.
This program is actually in Sweden, right? So what is special about digital health in Sweden? What are the positive points about digital health in Sweden? And what can Sweden learn from other countries?
I think Sweden has several advantages. One thing is that Sweden has always been at the forefront of digitalization. The first patient registry systems, computerized patient registry systems, have already been around since the 60s in Sweden. This is a blessing in a sense, but it's also a curse because Sweden is very diversified. There are no two counties which have exactly the same system. Each is very diverse, so it's hard to reach the entire market. But this long period of digitalization in Sweden, with access to patient registries, which is an enormous trove of information that we can access, is a great advantage that Sweden has. Mm-hmm. Then on the entrepreneurial side, on the digital side, Sweden has one of the most vibrant entrepreneurial IT environments, especially Stockholm. So you have the know-how there, and you have the clinical, the competence, the data as well. So, and the combination of these two, I think, is unique in the world. And we have to be able to leverage that.
So, based on this optimistic note, what are the products, digital health products, you would like to see developed in the future? Mm-hmm.
Some of the projects that I would like to see developed actually are coming, but if I'm allowed to be skeptic,
yes.
A lot of them are coming in through very large projects. Okay. And they make it hard. It takes a long time before anything happens. Even though there are big procurements coming up within 2 years, within 5 years, the government says things that, okay, we have to get this working, and they decide it, but then it takes 5 years, 10 years with all the regulations, with all the red tape, basically, to get these things actually working. Mm-hmm. And then they will have their startup problems and everything. In the meanwhile, 10 years, that's an entire generation of innovators, of entrepreneurs. Yes. that would go to a loss. So I would like to see these, you have to attack the problem as it is now. Mm-hmm. You can't wait for the system to be ready for it, because then it'll be 20 years. People who have been retired, the ones that actually could do stuff by now. So we want tools, help, methods to help them right now.
What will be dream product for you?
A dream product for me, I'm looking at the level, because I think of teams. How can they make their innovations? I want something that helps them get in. So a dream product for me would be a single point of access into healthcare. If I want to do something in healthcare, I have an application programmers interface. Yeah. Here you get information on the level that you need, without endangering patient integrity, with having all the information that you need to either improve health, to treat, to manage chronic diseases, but also to prevent disease, and to a level that you can even do research on this data without affecting.
Great idea, and I hope audience will listen to this.
We really hope that your dream come true. Thanks a lot for coming and joining us today, and we hope that you stay tuned and see you in the next video.